It can be tough to pick the most appropriate decompression setup for your patient. That's why I created the PrimoPractice Kdt module. It works with every software because it's cloud-based, and it's a small investment, even if you ignore all of Primo's other features. Leave it running on an open Google Chrome tab and easily select the proper cervical or lumbar pull weight and Kdt setup for each and every patient, and then just copy and paste it into any other software on the market. You no longer have to search through all your notes or wonder if the universal prone position will work on your next disc case. Easily select a setup based on your patient's positional preference to greatly improve your clinical outcomes. Simply enter your patient's weight, and a pull weight is recommended. As the doctor, you can modify this weight if you feel it is clinically indicated. If form closure is a factor, you can indicate it here. Now, just click the setup that represents your patient's positional preference or pain presentation, and your complete Kdt setup is ready to copy and paste into your note. If you want, PrimoPractice software can also serve as your complete clinical documentation EHR platform. And it is especially good for cash and PI practices. It comes ready to use with every possible note combination, pre-written by a chiropractor with over 30 years of successful practice experience. Yet every text replacement is easily customizable to meet your unique practice needs. You can also make your own exam screens and endless templates that can be accessed with the click of a mouse or the touch of a finger if you prefer using a tablet or iPad. Quickly create a first visit summary to send to primary care providers to stimulate medical referrals. You'll also have full access to SpineTech Pro software. SpineTech will create a visually compelling take-home report of findings, complete with cervical and lumbar range of motion, digital postural analysis, detailed spinal segmental Meric listings, over 50 digital spinal mensuration analyses that can be performed on digital, motion, or plain film images. Ligament analysis is usable and accessible to perform on lateral, cervical, and lumbar stress views for ligament analysis of ligament instability. Finish your report with a recommended action plan, or RAP, and a financial plan outlining your patient's financial responsibility and payment options. With all of these tools and the advice and help of implementing them, you'll see improvement not just in your decompression cases, but in your entire practice. So don't wait. Get the software 100% designed by a chiropractor for practices that focus on shockwave, laser, and spinal decompression therapy. You can buy it outright for just $999 if you own or purchase a Kdt table, or you can rent it for just $79 a month with no contract. Thanks. Let's get started building your practice.